Ever thought that ginger, a common kitchen ingredient, could wreak havoc on your health? Now, before you gasp in disbelief, let's clarify something. Ginger is often hailed as a superfood, packed with numerous health benefits. It's a natural remedy for nausea, inflammation, and even aids digestion. However, like all good things, it also has a flip side that's often swept under the rug. Did you know, consuming ginger in large amounts or certain conditions could lead to unexpected health problems? Yes, you heard it right. From blood thinning to interfering with diabetes medication and even causing complications during pregnancy, ginger can indeed be a silent troublemaker. So while it's okay to relish your ginger tea or use it in your cooking, it's crucial to be aware of these potential hazards. Knowledge, after all, is power. So hold on to your seats as we unveil the darker side of ginger. Imagine something as simple as ginger putting you at risk of excessive bleeding. Now that's a thought that could raise a few eyebrows, isn't it? Ginger, the root spice that's been used for centuries in various cultures for its medicinal properties, might not be all that harmless. Let's delve deeper into this. How exactly does ginger affect blood clotting? Well, ginger contains salicylates, a natural blood thinner. Now, under normal circumstances, a little bit of natural blood thinning might not seem like a big deal. It could even be beneficial, right? But here's where it gets tricky. If you're someone already on prescribed blood thinners, or if you have a bleeding disorder, consuming ginger might put you at risk of excessive bleeding. That's because the salicylates in ginger could potentially enhance the effect of blood thinners, tipping the balance too far and causing your blood to become too thin. And what does that mean? It means that even a minor cut or injury could result in significant blood loss. It could also increase the risk of internal bleeding. This is particularly dangerous for individuals with bleeding disorders, where the body's ability to form blood clots is impaired. Now you might be thinking, but I only use a dash of ginger in my food. That can't possibly be harmful, can it? Well, it's not just about the amount of ginger you consume, but also about the frequency. Regular consumption of ginger, even in small amounts, could have a cumulative effect on your blood's ability to clot. So, if you're on blood thinners or have a bleeding disorder, it's crucial to discuss your ginger consumption with your healthcare provider. They can provide guidance based on your specific health situation and ensure that you're not unknowingly putting yourself at risk. And if you thought this was shocking, wait till you hear about our next ginger-induced health problem. With so much to consider, who knew that the humble ginger could be such a double-edged sword? But remember, knowledge is power. Stay informed, stay safe. Did you know that ginger can turn your gallbladder into a ticking time bomb? Quite an alarming thought, isn't it? But the reality is, while ginger is often praised for its health benefits, it can also pose potential risks to certain individuals, especially those with gallbladder disease. So, what's the link between ginger and gallstones? Well, ginger is known to stimulate the production of bile in the body. While this is generally a good thing, it can cause problems for people with gallstones. You see, gallstones are essentially hard deposits that form in your gallbladder, a small organ just beneath the liver. Now, an increase in bile production can lead to an increase in gallbladder contractions. And if you have gallstones, these contractions could potentially cause a gallstone to block the bile ducts, leading to severe pain and possible complications. But that's not all. Ginger contains a compound called gingerol, which can potentially increase the risk of gallstone formation. So not only can ginger cause complications if you already have gallstones, but it might also contribute to the formation of new ones. Now, you might be wondering, how much ginger is too much? Unfortunately, there's no one-size-fits-all answer to this question. The effects of ginger can vary greatly from person to person, depending on factors like body weight, overall health, and the presence of any pre-existing conditions. But here's a rule of thumb. If you're prone to gallstones or have been diagnosed with gallbladder disease, it's best to err on the side of caution. Consult with your healthcare provider before incorporating ginger into your diet or supplement routine. They can provide guidance based on your specific health situation and help you navigate the potential risks. Remember, when it comes to your health, knowledge is power. Knowing the potential effects of ginger on your gallbladder can help you make informed decisions about your diet. And while ginger does have its benefits, it's important to remember that not everything that glitters is gold. Still think ginger is harmless? Let's dive deeper. Imagine a world where ginger can throw your blood sugar levels off balance. It's not a fantasy, it's a reality. You see, ginger, the root we often laud for its incredible health benefits, can also play a role in the delicate dance of blood sugar regulation. Intrigued? Well, let's dive in and explore this further. Ginger has been known to lower blood sugar levels. Sounds like a good thing, right? Well, for most of us, it is. But for those living with diabetes, it can be a double-edged sword. Diabetes is a condition where the body struggles to maintain a delicate balance of blood sugar levels, and ginger can potentially tip that balance. Here's how it works. Ginger can enhance insulin sensitivity. Insulin, as you may know, is the hormone that helps regulate blood sugar levels. When your body becomes more sensitive to insulin, it can use it more effectively, leading to lower blood sugar levels. But wait, isn't that a good thing for people with diabetes? Well, it's not that simple. For people with diabetes, especially those who are on medication, this effect can cause their blood sugar to dip too low, a condition known as hypoglycemia. Hypoglycemia can be a dangerous situation, causing dizziness, confusion, and in severe cases even unconsciousness. Moreover, if you're taking medication to control your blood sugar levels, adding ginger to your diet could amplify the effects of these drugs, again, leading to the risk of hypoglycemia. So, while ginger is a natural way to lower blood sugar levels, it's essential for those with diabetes to approach it with caution. It's always best to consult with a healthcare professional before making significant dietary changes, especially when you have a pre-existing condition like diabetes. In conclusion, ginger, like any food or herb, can have different effects on different people. It's all about understanding your body, your health, and making informed decisions about your diet. Shocked? There's one more surprise waiting for you. So, stick around as we continue to unravel the hidden dangers of ginger. What if ginger, a common remedy for morning sickness, could harm your unborn baby? A startling question to ponder, isn't it? But it's a necessary one. Let's dive into this surprising topic. Ginger, a staple in many households and a frequent flyer in various cuisines, is often recommended as a natural way to ease morning sickness during pregnancy. And while it can indeed offer some relief from the queasiness, it's not without its potential pitfalls. Some studies suggest that consuming ginger during pregnancy might increase the risk of miscarriage, particularly in the early stages of pregnancy. This is primarily due to ginger's stimulating effects on the muscles of the uterus, which can inadvertently lead to contractions. Now, it's important to note that the research here is not conclusive. Some studies say one thing, others say another, but the potential risk, however small, is enough to warrant caution, especially when it comes to the health of an unborn child. In addition to the potential risk of miscarriage, ginger might also interfere with the absorption of dietary iron and fat-soluble vitamins. These nutrients are absolutely crucial for the healthy development of a fetus. So in this case, the potential benefits of ginger for morning sickness might be outweighed by the nutritional risks it poses. And if all of this isn't enough to give you pause, consider this. Ginger can also interact with certain medications, potentially amplifying or reducing their effects. If you're pregnant and taking medication, any form of ginger should definitely be consumed under the watchful eye of a healthcare professional. The bottom line is this: while ginger can indeed help with morning sickness, it's not a one-size-fits-all solution. Every pregnancy is unique, every body is different, and what works wonders for one person might not be so wonderful for another. So before you reach for that ginger tea or ginger candy, consider having a chat with your healthcare provider. They can provide personalized advice based on your specific circumstances and help you make an informed decision. Ginger, a seemingly innocent spice, can indeed cast a long shadow over your health. So let's tread carefully and make mindful choices, especially when it comes to pregnancy. So, should you strike ginger off your grocery list? Not necessarily, but it's definitely worth considering the potential health implications we've discussed today. Ginger, while a powerful and beneficial spice for many, carries potential risks for certain individuals. Those with blood-thinning issues, gallstones, diabetes, or expecting mothers may need to approach ginger with caution. The key here is not to eliminate ginger entirely, but to understand that moderation is vital. It's essential to remember, every body is unique, and what works for one person might not work for another. If you're dealing with any of the health conditions we've discussed, it's always wise to consult with a healthcare professional before making any significant dietary changes. Remember, the goal isn't to fear food, but to be informed and make choices that best support our health. Remember, when it comes to ginger and your health, caution can make all the difference.